to order here. And we're going to get updates from our minor office procedures subcommittee, and then followed by that from the prescribing and furnishing authority subcommittee.
Did you want to go ahead and do the minutes first, tab 10?
Oh, should we do the minutes first? Okay.
It's probably the easiest one of the three.
All right, let's, sorry about that. Let's review and improve the meeting minutes from the July 25th meeting first.
And that's going to be page 60.
Has everyone had a chance to look through these? Are there any comments or questions about them?
Yep.
Greta, I know if you have no comments, we're good.
No, it basically says we met to do the strategic plan, and we did, so pretty straightforward.
Yes.
Yeah.
I motion that we approve the meeting minutes from the July 25th, 2019 Naturopathic Medical Committee.
Okay, can I get a second?
A second?
Thank you. All right, and I'm going to go ahead and do a roll call vote. Dr. Dara Thompson,
Aye.
Dr. Greta D'Amico,
Aye.
Dr. Vera Singleton,
Aye.
Dr. Bruce Davidson,
Aye.
thank you, Dr. Mina Yoon,
Aye.
Ms. Shirley Worrells.
Aye.
Thank you very much, and that's 6 moves.
Thank you. So at this time, I would like to get an update from the Minor Office Procedures Subcommittee. Who's speaking for them?
Yes, I will speak for the Minor Office Procedure Subcommittee. Bruce Davidson, Chair of said subcommittee. We have not had the opportunity to have another meeting. We lost one of our subcommittee members, Dr. Spar, who left the Naturopathic Medicine Committee. And so at this point in time, the committee is kind of in on hiatus and suspension until such time as we get another allopathic physician on the larger committee that can be assigned to the subcommittee.
Thank you.
And if anyone knows anyone who might be interested in serving the great state of California, please refer them to the governor's website and let them know if someone applies, because they will not know just because an application was submitted, FYI.
And also just a reminder that we don't necessarily need a committee member to serve on the subcommittee, although it certainly is great when that happens, but we can actually get a physician member simply to serve on the subcommittee who's not necessarily on the larger committee.
That is correct.
All right.
Would it be appropriate for us to seek someone out like that so that we can move forward until we have new committee members?
There were a couple of names thrown around, however, that individual has not contacted me yet, and I don't have any contact information for them unless I went through their board maybe. But we'll see if they're interested enough, they will reach out.
So mainly they would be there if it was not someone who's on the Naturopathic Medicine Committee. They'd be there to take part in the conference calls and offer their expertise as we move forward. So it's a pretty minimal time commitment.
Right, and they would still be paid per diem, but through a contract instead of per diem like you guys get.
And if we did have someone in mind for that, how would we go forward? Would we send them to you or? Great, thank you.
Thanks.
Do we have an update from the Prescribing and Furnishing Authority Subcommittee?
Yes, so as chair, my name's Mina Yoon. We've met 3 times and have come down to, I kind of attached some notes here because there was a lot of moving parts to this, and we're still in the very early stages of formulating this work. But we have come to agreement on several different aspects. One of them is that we are going to have We would like to have an exclusionary formulary. So for Shirley and Bruce, who might not know what that entails, the exclusionary formulary is like a list of drug categories, and we exclude the things that we will not be able to prescribe, versus including everything. And then, having certain names. So it makes it just a lot easier for regulation in the future. So we definitely agreed on having that formulary aspect of it. We are currently working on going through every single drug classification to be able to determine which ones naturopathic doctors should be able to do independently with supervision of a medical doctor or DO, what should be completely prohibited. And then we put a separate category of unknown as maybe things to talk about, or for example, maybe like the chelation needs additional continuing education. The minimum requirement that we did agree on as well was that everybody did need to pass the NPLEX pharmacology elective examination to be able to have these independent prescribing rates. So that is as far as we were able to get.
Thank you. And you guys have access to the exclusionary formulary that was put together 2 years ago, right?
We have access to everything.
Yeah, perfect.
And just so you know that the list of drug classifications that they're going through right now, there's over 700 classifications. So they're going through them each one, and they're putting them in a column, whether it's going to be just totally prohibited for NDs, whether it's going to be allowed with oversight, like for specialties like cardiac stuff. There's certain drugs that I know Dr. Quinn was very concerned about, that just any general practitioner, even he said as an MD, general practitioners should not be using these types of drugs. So there are definitely categories that you guys will see, and then there's the stuff that's going to be allowed, legend drugs, of course. So yeah, they're going through those, and it's going to take some time. Just so you guys know, it's over 700 classifications.
Do you have enough people to get through all of that? Do you need other members or support or anything along those lines? It sounds like a lot of work.
No, I think we have it. Yeah, I mean, it's great because we have Peter Koshland as the pharmacy rep, Dr. Quinn, so he's the medical doctor rep, and then the naturopathic perspective. So I think we have all the different perspectives. I think we just dish out what comes up on each of our perspective fields. And
Perfect.
so,
Yeah, thank you.
Yeah.
All right, great. Thanks for those updates. And then at this point, we were going to move forward to our legislative update. Is that correct, Rebecca?
Yeah, so that's going to be tab 5, and page 39. So there's no information in here, and just because we wanted to open up this discussion on items that I know we've talked about in the past, of what you guys are looking at when you're wanting to attempt modernizing our scope to kind of be in parity with other regulatory authorities for naturopathic medicine. So I'm going to go ahead and put it back to you guys on kind of the things that we're looking at. Of course, we're working on the formulary, and we're working on minor office procedures as soon as we have another physician that can come into play. So these are some of the things that we're already kind of looking at, and I know that I think that you guys are still interested in going for the things that were in SB 538 originally. So these are just all things that would really modernize our scope to put you guys equal to other states. And I know CNDA's here too, so they've looked, or they've taken SB 538. They were the ones that took that bill forward last time, so we can probably look to Kathy to see if she has any questions or anything like that as well.
So do you have on your list the midwifery?
So I do not have midwifery, but I know that that's something that we wanted to take a look at because and of course, this was when Tara Levy was still on the board. She was really into this, but there is there's a reference in the statute right now on a provider that is no longer in existence. So we really have to go back in there and figure out who's certifying these midwives, because right now it's done through, I believe, I want to say nursing or something. It's done through something that's not with naturopathic doctors.
Right. I actually attended a lecture that put all this out, and you can be a certified midwife who is not a nurse, and you can also be one that is a nurse.
Right. But the programs to be able to do this are not, there's none that are in the schools that you guys go through naturopathic medicine for. So you would have to then go over to one of these approved schools to get educated for that part of it.
Midwives are licensed to the medical.
Right, through the medical board. So that is the problem that we're having, because when they changed this, they didn't take into consideration all the players. So they went and they made this change, and it made our statute become defunct. And this was several years ago, before I was even here. So it's been totally outdated for a while. We don't currently have any NDs that are not already certified as a midwife, or that have requested to become certified with us as one. So
that's a subject we might want to table until we get through some more pressing issues, and then revisit if it seems to be an issue, but we're not getting a lot of worry about that particular one.
Sure.
So we're just listing everything here that our wish list. Is this what this is?
And then are we waiting to get further along with our subcommittees on the formulary and the minor office procedures prior to bringing language for a bill forward? Is that?
That would be my suggestion. You want to have all of your asks in line before you go and make that request to the legislature. So I would definitely have kind of what you guys are wanting in terms of formulary and in terms of minor office procedure before we go and ask for that scope expansion. And that's why, sorry, I don't want to call it a scope expansion anymore. We're really trying to modernize it. So that's why I said I don't think that we could have gotten onto this legislative session. We just did not have the time to prepare to get everything in line to do that. And we want to make sure that any questions or any concerns that are going to be there are kind of, that we already have that in mind before we move forward. Another part of this was to be able to allow NDs to give orders to nurses and LVNs. Unfortunately, it was scheduled for the NMC, the RN board, and the LVN board to all be sunsetted at the same time, to go through the sunset hearings at the same time. Unfortunately, they rescheduled the LVN, so they are going through it this year. So for us to get any kind of language done with them, it would have, I mean, it's going to be coming up here any minute. So February, March-ish is around that time that those sunset committees start going on. So it doesn't mean that we cannot still go and have talks with them. It just means that we wouldn't be able to open all the acts at one time, get all that done, and then close them and not have to worry about it. We were hoping to do that during sunset because that's one time that the act is open and they're going to make changes regardless. So we wanted to do it the easiest way possible. Unfortunately, the LVN is going through sunset a year earlier than previously scheduled.
Sorry, go ahead.
Is it not that the language for this is pretty straightforward and simple? I mean, if they have the will, could it not just be put in now?
If we were able to get together with the two other associations and with their boards and come up with whatever it is that you guys are going to come into agreement with, whatever those orders and how it is. I know that there were some questions about advanced nurse practitioners because their scope currently is more broad than that of the NDs.
Are you saying you don't want to approach the LVNs until we also have agreement with the regular nurse?
No, I'm just saying if you go to them right now without having something in play, I mean, they already have that bill, I'm sure, ready. So for us to go in there and start making changes to their sunset bill, I mean, we probably should have already been talking to them
So when will the next opportunity be?
in another 4 years for them. But it doesn't mean that we cannot go. It just means that they have to open up their act when they don't have to.
What's the likelihood of their willingness to do that?
I don't know. I'm not sure. And because I can talk to the board all day, but unless the association's also willing to play, because it's,
So what is the association? Does it actually exist? Is there one?
I don't know. Now, I have not talked
Have
to,
looked, several of us, and maybe somebody else in the room knows the answer to that question.
sure.
You were just talking at lunch.
Did you guys want to come up to where the microphones are so that it's recorded?
So I'm Kathy Krantz with the CNDA, and this is Mike Robeson. Turn your microphone.
I think they should be on already. Maybe. It doesn't look like it. Hang on, I can probably turn it on.
There's a small button right
I have a question while we're waiting for that. I know that it's our goal to have supervisions of both LVNs and RNs, but does that necessarily have to happen at the same time?
It doesn't have to. It would have probably been easiest that way. With the RN board going sunset at the same time as we do, it would be extremely easy to put those requests up while we're going through sunset because the act is already open. There's already a bill in play for us. Trying to go and find somebody that's going to take this on, then we have to go and find somebody that's going to take on this separately from our sunset.
Just my personal perspective at this point, it does seem that if we're looking at what will allow naturopathic doctors to practice to the full extent of their training, that the supervision of RNs is definitely significantly more beneficial to the
Sure.
profession, because right now, most of what an LVN could do is something the naturopathic assistant can do, but things that an RN can do, like administer medication for you, for example, is something that, our assistants cannot do, and it allows the doctor to be able to reach more patients and serve more people if they have that nurse supervision in place. So it's just a perspective.
Absolutely.
So,
Oh, there you go.
So that's good for us to know, good for me to know in particular, because my thought was, it might be easier to get the LVNs approved, but since they're coming up now first, it would have been difficult to get it done. In the meantime, I just got some new information from Mike here, but because Rebecca and I had been speaking, and Greta actually had reached out to me about going association to association, sort of, from director to director, and just have this conversation. And I haven't been able to get that done, and I reached out to our lobbyists to see if there was something they might be able to do as well. And Mike, you just gave me something that was a little disturbing.
Well, it's not disturbing, no, just, I think the advice you're getting from the executive director is the right advice. You're not going to, it wouldn't be, I don't think it would be politically or even, well, even possibly even physically possible to just spring this idea on either the LVNs or the RNs, right? You need to cultivate that and bring them into the mix. I mean, it'd be the same way as if your Practice Act was open, and you wouldn't want some third party to come into and start messing around with your Practice Act either. So you're going to need to have a conversation with them, months and months ahead of time, and be prepared for it. And so I think that's good advice. And
Can you say your name, by the way?
I'm sorry,
We
it's
have not.
Mike Robeson, and I'm a lobbyist at Edelstein Gilbert Robeson Smith, and we have a legislative monitoring contract for CNDA.
Great.
So what Mike told me was basically that they had spoken to the internal lobbyist with the RNs, and they weren't interested in doing anything right now. So I really think that the approach that we're going to take is really try to establish a relationship between the associations. I'm going to attempt that anyways, to see if we can't get some conversation going, because from this perspective, we feel that it would be really beneficial to the naturopathic doctors to be able to have RNs working with them. But I think it's also very good for the RNs to have the opportunity to be able to expand and have more opportunities to work as well. So it just has to be, we have to do it as a mutually beneficial type thing. And if we can get something done this year, where next year we can at least put it into the RN sunset bill, and as well as ours. Does ours have to be changed as well?
Yes, because we have to have the authority to give orders to them. So it would be both
Okay.
opening up.
But I didn't know that it would be more beneficial to have RNs than LVNs, and obviously if we get the RNs, we'd work on getting the LVNs as well, but, so any kind of input that you could give us as to what steps we should take, if there's things that we should be careful about saying or talking about. Or
Sure.
whatever that would be.
And, we can have the Department of Consumer Affairs, can help kind of moderate this and bring us together and kind of facilitate everybody talking, at least the boards, and then we can reach out to our professional associations and invite them as well. But I think everybody needs to be at the table to play on this. That way, everybody knows what we're asking, everybody can put their 2 cents in, and we can take that and move it forward at the same time. And if we can all kind of get on board before that sunset, it would be the perfect time to ask for it. Now, whether we can do it or not in a year, it just depends on how quickly we get this started. I know we've already had discussions with the Board of Registered Nursing. They were totally on board with it, but, it's always the association when they're taking a bill. So that is somebody that we need to kind of bring into the talks as well.
So I've attempted on several occasions, which I just did again, to find an association for licensed vocational nurses, and I don't find one at all. There might not be one.
I think it's the American Nurses Association of California.
It deals with both.
And they do exist. I'll track that down for you.
But it sounds like the board that we need to be talking about more eminently is going to be the Board for Registered Nursing.
Right.
I think, to be clear,
Association.
please correct me if you guys know, but I believe that an LVN can take orders. So one of the big problems is that medical assistants can only do whatever they do if the doctor is on the premises. They cannot even take a patient's weight and write it in their chart if there's not a doctor in the clinic. But an LVN is working both in the field and in the office and can take doctor's orders. So a very common example of where this comes up is when people have in-home care. The naturopathic doctor says, I want you to take 500 milligrams of vitamin C with your lunch, but the care provider cannot give them the vitamin C. It's completely dependent on the parent or the main caregiver, the legal guardian to do it. They have to be present. The LVN cannot give supplements. They can't help them do tests. They can do absolutely nothing having to do with naturopathic care with the patient. So that's one example. They can take orders, and they can execute those orders with or without the doctor there. So if you have an LVN working in your practice, you want somebody to come in and get a blood pressure check, they can do that and enter it in the chart without you actually having to run into the office to be present for them to do that, okay? I think I'm not sure if LVNs can start IVs, but I think they can. They cannot mix the bag, but they can start the IV. So that's a pretty significant impact on the doctors that are doing IV therapy, because they are very burdened by trying to employ naturopathic doctors to do these things. It's a great expense. It's not something that people want to spend their whole careers doing. An LVN is very happy to do that. So it is not, just to be clear, it's not even close to naturopathic medical assistant at all. Naturopathic medical assistant has to be supervised when they supposedly drop a shot. We're supposed to be there watching them, and LVN does not have to be. So it's a very different animal. Yeah. So was I wrong on anything? Did anybody want to have a correction for me?
And
That's
I
what I
think
understand.
it's safe to say that we are interested in having the authority over giving orders to LVNs. It's just that we're going to have to do it in a way different than what we were hoping to do, with just all three of us being sunsetted at the same time. We would have been there, probably would have been really easy to do, but it's okay. We can still start those talks with them and maybe find somebody that'll just carry that bill for us in the future.
So it seems as the timing question that we're discussing is very relevant to providing opportunities to move forward. But it also sounds like there's a little bit of a chicken and an egg situation with regard to A, needing to have language ready, and B, needing to have existing relationships with the boards and the associations. And I wonder whether there's also an additional moving part, which is needing to have relationships ready with legislators who would be willing to carry. Because I'm not sure, and I guess this is the question that I was coming to, is if we had language and if we had relationships and everybody agreed among the various players that the language was fine for each of them and were willing to do it, is it also a challenge to have brought on board the legislator who will carry it? Will we find it difficult to, even if we have the first two things lined up, those two ducks in a row, is it a slam dunk that the legislator will be willing to carry it? Or not? I mean, because that's a relationship too.
Yeah, I would say, again, I would go with the advice you're getting from Ms. Mitchell is if you've done the first two, and you know, if you have the first two done and again, if all the acts are up at the same time, then authorship isn't a problem because there'd be no opposition, everybody is on board, and the acts have to be, well, they don't have to be, but they will be, they should be unsunsetted, I mean, you know, sunrised. And so I don't think that would be an issue. The issue would be if you came up with an idea and you didn't vet it with the other stakeholders and tried to spring it on somebody, then you'd have a problem. And that would be a long-lasting problem.
Yeah, that's never been our plan.
That would be something that they would hold against you probably forever.
It's never been our plan, and we've been talking about getting these stakeholders together for a couple years now, so I'm wanting to just get it done.
And if everybody remembers, right, the last time that we brought this up, we had just went through a sunset. So our acts were closed. We were just grateful that it was closed and nothing else was changed the way, you know, we had it. So, I mean, at the time, the RN board did not want to open their act if they did not have to, and we totally understand that. It's never a good idea to open an act because when it's open, anything can happen. So I totally understand that. Do we have a chance to get the LVN to reopen it after a sunset? Yeah, it's a possibility. Will they just want to wait until their next sunset? That's a possibility too. However, I know that the first ask we wanted was for the RNs. And I know that that's been the main goal for several years now. So I think if we start there, bring in the LVNs because we still want to have that conversation and get those relationships going, and try to make it as organic as possible and then just kind of move forward. I think that's going to be our best bet. So,
Okay, so in order to do that, though, I thought what I heard you say is that we need to have language that we want to bring to discuss. So
Right.
that's sort of the nitty-gritty specifics of it. But I would also imagine that there's just the more general sort of opening the door
Yes.
kind of conversations. I mean, where things that are discussed are, well, wouldn't it be nice if everybody could benefit by, having more opportunity to do more work in more settings? So there's the opening the door discussions, and then there's the nitty-gritty discussions. The nitty-gritty discussions require language, but the opening the door discussions just require ideas, don't they?
right.
Yeah.
Yeah, and so if we can just get together with all the players, and again, you're right about going and finding a legislator that will take on something like this. You want to find somebody that has some kind of knowledge of what a naturopathic doctor is, and that's why it's so very important to us when we were doing the strategic plan to make sure that that education and getting the right information out there is so important, because there was a lot of misinformation that was passed along back in the day, and unfortunately, you still have people today that don't have any clue that there's even such thing as a naturopathic doctor. So we need to definitely make those relationships. There's been a big change in legislators. There's several new people there, so we will have to reach out. And I'm sure sometimes lobbyists have some general relationships already established. They may know who to go to, so we will sometimes kind of look to the lobbyist. We can also use the legislative unit with DCA because they also have those relationships kind of established a little bit. So we do have some different things that we can do, but we really need to figure it out what it is that we want and then proceed.
When is the ND sunset and RN?
2021. We will start going through all of the stuff the later part of this year.
And are there any objections at all to either LVNs or RNs?
I haven't heard any. Everything that's been coming to our board or to our committee has been a want. They want to see this happen. We have nurses that are saying, why can't I work for an ND? So I get it. I have not talked to too many LVNs. I haven't talked to too many NDs that were really wanting to reach out to an LVN. However, I have heard it in the past, so that's why we went ahead and decided that we should include them so that we're not kind of creating any barriers there. And absolutely, anytime that we can assist with the opportunity to create employment out there, that's a great thing, so.
Are we able to include the language for both RNs and LVNs in our sunset, which then would just allow the LVNs to put it in there next, or does it have to happen simultaneously?
I think it has to happen both at the same time, because you can't have one that supersedes and there's nothing over here to catch it. They both have to kind of,
So it sounds like at this point, we have to focus on the RNs and try to add the LVNs in the
That would
future, but
be-
we should start the conversation.
that would be probably a very strategically sound way
Okay.
to go.
So
And I'm sorry, they were originally supposed to go sunset 2021, but it got changed a year.
So should we have another subcommittee that's working on that language? We don't, I mean, at this point, have any.
Well, we're not to a point where we need language yet. We're still on
We
the.
need the asks, yeah.
Right, we still need the ideas,
Right.
like your wish list.
And do you see that as coming from us, basically, as
And-
opposed to like a subcommittee, the way we've got that other work organized,
So,
maybe?
yes, because there are some pieces of that we probably should have in play already to start moving forward. Because basically, if we were able to get the scope modernization done, then you guys could also have nurse practitioners, because the scopes would be like this instead of like this. So right now, we have to take in mind what all of the scopes are. And that was the only pushback I had with the RN board when I had a discussion with their EO, was that there are some licensees that have a broader scope right now than an ND. So that was the concern. So it would have to be just the RNs and not the nurse practitioners, or the other way around, I don't know, but
And it's
Before
the
we
same
leave-
board,
They're different boards.
the nurse practitioners and the RNs?
no, they're both the same board.
They are.
Yes, the LVN is a different board.
So that's what I meant.
Yes.
So before we leave the LVN thing for a second, because I have their whole statutes right in front of me, the only thing that needs to be changed is the word physician, directed by physician and surgeon. It changed or added to. Everything else, scope-wise, everything else is exactly what we want. So language for that is easy peasy. You could just copy and paste it and you're done.
Sure.
She has a
And that's
tight
what a
lip,
lot
but
of them
not
is.
a raised eyebrow, so I think we're okay, but with concerns, with caveats.
I think like everybody already said, if it works with the timing, it works with the timing, but we're at a.
When the time comes. I'm not
yeah.
pushing the timing, I'm
I'm-
just saying when the
right.
time comes, language is actually, can be pretty easy, and I will look at the I want to look at the nursing scope to see, because we're kind of operating an urban myth here, and I want to be sure, what is it that they can actually do that we can't do? And it depends, there's lots of different kinds of nurses,
And
right?
if you want, I mean, I don't want to give you work, but if you want to look into that, absolutely, then feel free to contact your executive officer. She's the one that's going to be in contact with the boards and the associations, and so when we're asking for your ideas and wants or asks today, you're not cut off after we leave today, right? You can email her, you can call her and go, I thought of something driving home, and can you add this to our list?
Sure. Yep.
So it's
So-
always open.
Yeah, and so another thing that we need to keep in mind is we now have a scope modernization that we're wanting to try to go after. We also have a sunset coming up. You don't want to combine those two unless everybody's on board with it, because there's going to be so much contention. You do not want the possibility of you not being sunrised. So we don't want to add anything that's going to be very contentious to a sunset bill or sunrise bill. So that's just another thing to kind of keep in mind. And I know that we really wanted to get into this session, this legislative session, with the modernization bill. That's not going to happen just because we don't have the two pieces to move forward with yet, for the formulary and for the minor office procedures. However, we want to make sure that those two things aren't being done at the same bill. They may be able to be done at the same time on two separate bills going through, but we just want to kind of keep that in the back of our heads too, is that we are asking for a scope modernization, which could potentially make it a lot easier for us to get the orders for nurse practitioners and registered nurses, so it would include the advanced practice nurses, whereas right now we would not be
So
able to
we
get
could
that.
potentially get in as a 1 year next January, next year?
I don't even want to say that, because it's very hard to get
So we're
something as a
most likely
1 year
looking
when
at
it's like.
legislative cycle starting 2022, right?
No, because we can still push forward. It's just, we wouldn't be able to ask for the advanced practice nurses right now. You just have to know that. With the scope that it is currently,
We're talking about the scope modernization.
yeah, but then we'd be waiting for the next sunset, which is 4 years from 2021, or we have to have a bill in.
Wait, I'm talking about like everything, formulary and minor office procedure, all the stuff that we've been having on our list that we've been working on. What is the earliest time we can reasonably expect to present this?
You could present it next year, but then you'd only have a 1 year session.
Yeah.
So if you wanted a full 2 years, please correct me if I'm wrong, because I'm just trying to think back. If you don't bring it next year, then you'd have to wait until the first part of 2022
That's what I was
to
saying.
introduce.
So you're saying next year, you mean this year?
I mean, this legislative year, yes, sorry.
So I want to get back to Bruce's question, because I think it was a really fundamental one, which is like, who's doing this? So if we want to, putting the scope modernization stuff just a little bit to the side right now, but if we want to add nurse supervision to our sunset bill, which sounds like it is something that wouldn't be particularly contentious and that we have a reasonable chance of getting through, because they're happening at the same time. Everyone seems fairly on board. We couldn't do the APRNs, but we could do RNs alone. how do we make that happen and who needs to do it?
So that part is easy. What we would do is we would go to the BRN, we would talk to the two associations, we'd say, hey, is everybody on board with this? This is what we want, this is what you guys are wanting, and then you get that information, everybody's on board, you go to the committee that's doing the sunset. And it's their oversight committee, you bring it up to whoever that is, because I don't know who it is this year, so you'll bring it up to them, they will either say yay or nay, and they will add it to both of the bills, or the one sunset bill, depends, because last year we were only on one, and there was another one with others, so it just depends on kind of how they're doing it, but we would definitely want to reach out to them before that starts happening, so that they are aware of what that ask is going to be from both programs.
So that would need to be you and then potentially some committee members as well.
Yeah, so that DSA can also get into helping facilitate. Lobbyists can also help facilitate that. So again, if everybody is on board with this, then we're going to move forward with contacting the committee, telling them what those asks are for the two programs, letting them know that those two programs are going sunset at the same time, and they could potentially put it into that language at that time.
Yeah, I mean, I think we should definitely move forward on that. So do you need committee members to volunteer to work on that? Is that something we need to do in committee? Is that something we can add on later?
Let me go ahead, I can reach out right now to the Department of Consumer Affairs and get our legislative staff kind of starting on this. We will also kind of defer over to the lobbyist that is kind of keeping track of everything for CNDA. And then we'll just find out kind of who's on the committee right now, who we need to reach out to. I know that we've got some members that were here last year that are now over there, so I can make a couple of phone calls as well and try to find out kind of who's taking care of this right now.
Great. I just think we should move forward on it so we don't miss our window of the two sunsets being lined up.
And just a little question, is there any statistics or anything that we have to present to them regarding the fact that how many jobs are possible? This might be on the association side, but also any NDs that have been cited because they do have a nurse, any of those numbers that we can also
So
approach
right
the
now,
boards
we
with.
have gotten a few cases where it's been called into us that they're giving orders to a nurse, and every time that we have investigated it, it has been false. So I don't know if people just don't understand that there's an NA that may be in there, and hopefully they're within their scope. But I do know that it's one of the things that everybody's been asking for. So I'll definitely do what I need to get kind of everybody together on this, and we'll just start moving forward with it.
I also think we have standards from other states because there is nurse supervision in multiple other
Yes.
states.
So I will reach out to the FNMRA and AANP and see if they have any stats with other states and who with other states are allowing the NDs to provide orders over nurses. And we'll see how many states are already allowing that. We will try to get some sample language from those states. That way we have something to kind of provide to the legislators when we move forward with that.
So as far as the wish, so we'll go forward with that, and we don't necessarily have to wait till our next meeting. If you need anything, you'll let us know, right?
Yes.
Okay. So that's the nursing part of our wish list, but there's several other things. Did you guys want to bring a few things up?
Well, the one thing that we were talking about was clarification on independent contractors, and Mike had some specific things that I think that would make it easier for us to understand exactly what the issues are, so I don't know if you want to.
This was for the AB5, correct?
Yeah.
So, well, we've been generally made aware by CNDA of concerns that NDs have with the ABC test for determining whether somebody's an independent contractor or an employee. And I think if if you're not aware, there was a bill last year to codify the court decision on this subject, the ABC test, and in codifying that decision, there was, they carved out a whole bunch of industries or professions that should be exempt from the ABC test and would still remain under the previous test for determining independent contractor or employee, which was called the Borello test. So amongst the industries that were carved out of the ABC test were physicians and surgeons, and it was worded as physicians and surgeons. I don't personally know the background of how, if that devolved from, from a broader category of medical professional, and it devolved into just being physicians and surgeons, and if it was an accident, I don't honestly know how that happened, but we become aware that NDs are concerned that as a profession could fall into the category of an employee, and would want to remain independent contractors. To go forward on this, we are aware that there will be a bill in this legislative session to deal with a whole bunch of health professions that were not included in the carve out, and in order for the naturopathic doctor profession to be included in that carve out, it would be helpful to understand the business to business relationships you have, or that the NDs who want to remain as independent contractors, to understand those independent contractor relationships as they exist, and what we truly, that's it, just to understand the business to business relationships. If you want to maintain a business to business relationship as an independent contractor, whether it's with another ND, whether it's with a physician group, a hospital, whatever, we need to understand all the different relationships and how it impacts. We can't just anecdotally say, oh, well, NDs need to be included just like physicians and surgeons. We actually need to make an argument for this. And so to the degree that anybody in this room is able to put that together and have talking points on it, that would help facilitate that.
Sure. And it's, I think it would be easy to do because ND is primary care. And just like physicians, they're going to be very similar in the exact same ways that physicians have business-to-business relationships. So I think that it would definitely be easy for the NDs to put something together, but they're pretty much the same as a physician would be.
Do you need specific anecdotal stories? Do you need statistics?
I don't know that statistics are right. I think just examples of examples of the relationships, because everything I just listed, I was just sort of making up off the top of my head. I don't actually know what your relationships are with other entities, whether it's with each other, or whether it's with a physician or with a hospital. I just would like to understand it and be able to explain it to a committee consultant and make a compelling case that that this profession deserves the same treatment.
So just
And
to
what's your, sorry,
just go ahead
what's your timeline on that?
Soon.
today.
Like,
I mean, so here's the
By the end of the month.
calendar. The legislative calendar is, bills are being introduced through February 21st. They're slowly trickling in. We know there is a health professions bill out there that will surface out there. I'm certain that at this moment, it would not include, NDs. I don't know who it would include right now. But we can't go ask for NDs to be included in that unless we are able to make an
So
argument for why.
just to clarify the differences between the old way and the new way. So my understanding as a business owner is that if I hire somebody to do something and they do this for others, for other businesses as well, they're an independent contractor unless they specifically want a job and to be, I decide to hire them as an employee. But if they only do it for me, then they should be considered an employee. Is that correct?
Well, I would say that's generally correct. Now, in AB5, there was a definition of a business-to-business relationship, and I think it had 12 components to that. So again, it goes back to, did that suffice? I don't know. I mean, so we have to show that why the existing business exemption with its 12 components isn't a sufficient, catch-all for NDs. And so that's what we would need to.
I don't understand the problem, I'm sorry.
Okay, so AB5 carved out industries or different jobs that should still be considered when determining whether somebody's an independent contractor or an employee. It listed a whole bunch of things. So, barbers and cosmetologists, physicians and surgeons, stock brokers, blah, blah, blah. There was a broad category of, business-to-business relationships are carved out, would still be considered under the Borello test, but that the definition of a business-to-business relationship had, I believe, 12 components to it. You had to meet, I think you had to meet all 12 of the components, and so we would have to show why that business-to-business exemption isn't sufficient for an ND, for an ND's business. I mean, so that's what I would be asking for.
Sure.
Because the Labor Committee, okay, so this is going to go through the Labor Committee. Labor Committees, both Labor Committees, their intention is they want people to be employees. The overarching issue is this idea that people are being exploited as independent contractors. They're not getting the protection that they deserve, and they should be employees. So we would have to show the committees, the committee chairs, and the members of these committees that the NDs in a business-to-business relationship are not being exploited. You'd want to show that. You'd want to show that you truly are a business, and that you have you're setting your own hours. You're setting your own you're negotiating for your pay, and you have an equal footing with the person you're contracting with. That's sort of a threshold thing, just in general. But the other thing is that we have to show that there's actually a problem. So it does, and I'm asking is if the business-to-business relationship exemption isn't already sufficient. And maybe it is, maybe it isn't. We would need to know, and we need to be able to show the committee consultants that it's not sufficient in order to even go forward.
Yeah, and when I spoke to the committee staff, we were told that, but you guys should fall under the same category as physician, surgeon. Unfortunately, because it doesn't specifically say doctors or primary care or whatever, I think going through that list, I don't think that we can kind of get under an umbrella of that. However, it would not be hard to show the very similarities of a physician, surgeon versus what a naturopathic doctor does. So I think if we can come up with a list of stuff in the next couple of days or a week or so, I'll go ahead and forward it on over to you, and we'll move forward from there. Do you know, does it have a bill number yet?
No.
You don't know? Okay. I know we've been hearing about it, so I'll find out. It's okay.
It hasn't been introduced yet.
Yeah, and by the same token, we want to protect NDs that perhaps are really acting as employees as opposed to independent contractors as well, because there's been, that happens as well. So whatever it is, I think we have to be careful to make sure that we are doing what's right for everybody, right? Let me see what else. Do you want me to continue with, or I don't know, you guys want to finish that thing up before I do my
Plan for that?
What do you
just
want?
tell
So maybe Rebecca could restate what she has in her notes of what at least your primary priority asks are, and then, with the same ideas, you can, contact her if you have more ideas. And then what she'll do is what she normally does. She works in the background and reaches out and does her magic behind the scenes.
I don't
And
think
then-
we're done with the list yet, though.
Well, if we're not done with our list.
Yeah. right? 'Cause
I
you
don't know,
guys-
I'm confused whether this is the update
No,
or
I think
the,
you're still doing the modernization.
right,
Yeah,
yeah,
I
that's
think
what
we
I
just
wanted
kinda-
to.
So I don't
It's
know.
okay, but you guys can stay there because you may have some questions and we want to make sure it gets recorded and you guys are going to be following right after this, so.
I mean, can I ask one other thing, because it might fit in here, but I don't know. One of the, there are a few things that a lot of our doctors are asking for, and so I'm reaching out to Rebecca or to others to say, all right, can we get some clarity on a number of different procedures? And you've listed a number of them that we went through today, which is really, really good. There's others that have not been, but I'll present those to Rebecca and they can be brought up again. But one of them was Narcan, specifically.
Narcan?
Narcan as being something that could be in the offices for people who are having a.
So I can just tell you that I'm certified to give Narcan.
Yeah.
And if I can be, so can you. So, no, but really, it's a little training course that you go to and you can get it. However, if we can get it included in our scope, just like epinephrine, it'd be great.
So
And I think when they open our scope for Sunset, it would just be a really easy ask, hey, with that little blurb about the epinephrine, can you add Narcan? Because it's such a big, logical, yeah, very logical to have, because you don't always have a Rebecca on staff to give it to them, yeah, so. So, yeah, we can definitely add that to the Sunset Ask, because that's an easy, I don't think anybody's going to have any problem with it.
So I just want to summarize at this point that we are going to move forward with the coordinating with the RNs to add RN supervision into both of our sunset bills, that it does not seem realistic to move forward with the scope expansion this year, but we are wanting to get these subcommittees to a place that we could do that in the following year, which will be a 2-year cycle.
Right.
The only other legislative thing that we haven't touched on currently that I can think of that was in the previous meeting was the cannabis CBD stuff, and that comes up, I mean, I personally get asked about that on a regular basis.
Yeah.
So do we have any clarification on that with NDs?
So when I discussed this with the Attorney General's office, we were just trying to get some clarification on whether it's something that we needed to ask for, or if because of some of the most current reclassifications of the drug federal level, if we would be able to do it. Because our scope is written the way it is, we would actually have to request that in scope. So that is another thing, and especially because the NDs are so well-trained in all of the herbs and stuff like that. So I think it just makes sense that when they open up the sunset, that may be another one of those asks just to put it in there for recommendation's sake. But I know that the Vet Med Board got it after the fact, so it's not something that would be difficult. If it was not done at sunset, we could ask for it to be done when we move forward with the scope modernization. So, and I don't think that's going to be too contentious, so I think we probably could ask them to include that language that is similar to the Vet Med into the sunset language.
And does the Vet Med bill allow for recommendation, or is it simply allowing for discussion with the patients?
It's allowing discussion to the animal's human person. Yeah.
Right.
But no prescription?
It's not prescription right now anyway, it's just recommendation. Yeah, so I think we want the recommendation. So I think what we would do is just ask for the same language that the physicians and surgeons have, or the podiatry, because podiatry does have that recommendation language, and there's not just discussion.
And then how does this pertain to CBD products?
So CBD is different than cannabis in total. So CBD right now is something that you can go to the grocery store and get off of a shelf at this point. So it is not something that you guys would be prohibited from. It is a natural substance, and CBD is not classified as Schedule 1. It's not, that by itself is not prohibited.
So So the current, because I don't think this was clear when we spoke about it a year ago, because it was very new. But just to clarify, currently, naturopathic doctors are allowed to discuss the use of CBD with their patients in conjunction with the rest of their treatment plans. So if someone were to come to me and say, I'm taking melatonin and chamomile tea and a CBD gummy at bedtime, is that going to interfere with anything else I'm doing? I could answer that question legally.
You can answer that question legally.
Okay.
But if they say I'm taking CBD with 2%
THC,
THC,
then you can't, right,
then I
Got
can
it.
say, well, the CBD part I agree with, and the THC part I can't comment on.
right. Yep. Because you can get CBD over the counter now without,
They like dog treats and that stuff.
yeah, they do.
Same.
They got shampoo and conditioners with it in there.
Good for your hair.
I don't know. I have no clue.
Make your hair more relaxed. Try it out.
All right, so do we have any other information on the legislative update, or can we move on to the CNDA's update at this point?
As long as you guys have had all of the things that we want to kind of put on our radar on here, then I think that we're
Yeah.
ready to
There's
move
nothing
on.
else you can think of, I'm assuming? We're all just making sure we don't miss something and feel done
No, but if
after.
I think about it, I will bring it back to your guys' attention.
So just to summarize, for the for the sunset,
Yes.
is it sunset or sunrise? I'm sorry.
Well, I think they call it,
Modernization, too.
yeah,
but
yeah, scope
yours-
For the
modernization.
Sun Bill.
So it's the, yes.
For the Sun Bill, RN supervision, clarification on cannabis.
Yep.
Those we're definitely putting in. For the minor office procedures and formulary, we're waiting a year on those, but we're still doing the groundwork.
Yes, that is correct.
And we're trying to get independently information regarding independent contractor status. That is another topic that does come up frequently and people ask me questions about, so I think it's very pertinent to our licensees.
Yeah. Yep.
I think that one of the issues that comes up frequently, and I think you may agree with this, is that it's not that people don't want to follow the law, it's that they're not entirely sure what it is. So we're working really hard as a committee to clarify those things for our licensees.
That is accurate. All right, so we're done there. I have the cannabis recommendation, the Narcan, and the ND supervision for RNs, all in the sunset asks. We have scope modernization for MOP and formulary on here, and we also have the midwifery that we kind of need to take a look at. And I think maybe that's going to need a subcommittee later on down the line, but that's just something that we should keep on our radar.
Also want to just mention, so I don't forget, that we are going to need subcommittees or a subcommittee to approve CE providers for the injection therapies. That's not something that needs to be approved in full committee. I can assign that subcommittee, but if it's something you want to be on, you should let me know.
Yes, yes.
There you go.
All right, so I think we can go ahead and move on to the CNDA's update. It's going to be tab 9. There's nothing back there, but just where we are.
Blank page.
Okay, well, thank you. And for those of you who don't know me, once again, Kathy Const, I'm the executive director. I've been there since July of 2016. And I haven't really been involved in too much of the legislative stuff, although I kind of wonder why I haven't been. But, you know, it makes so much more sense so that we can have that continuity between board members and we have a strong presence with the office. We moved over the summer, and we are now located in Santa Monica. We used to be in Culver City, and so we're in SoCal. There are 2 of us full-time right now. We've had some staff changes, and many of you may have known Frances McAdam, who was there for a long time, and she was a legislative kind of representative and membership coordinator, and she went on to a new position with IMAX, and so she's very excited. And we have had the pleasure of having Dr. Jennifer Greer, who is working sort of an interim, and she just got a job and will be moving on to Thorne in South Carolina. So she's really excited, and that's good. And now we've got some new transitions. But That being said, I'm just going to bring you up to date a little bit. We have just under 500 members, member doctors, and we also have student members. Last month, or actually this month, we had a student enrollment kind of luncheon at Bastyr in San Diego, and so a number of students went there. We tried to get them involved with CNDA early on. Our conference is coming up at the end of the month, February 28th through March 1st in Palm Springs, and a number of those students come in and intern with us, and we give them the benefit of being able to get free credit, and we put them in rooms together, and at least they can have be able to spend the night. But it's going to be a nice conference. This year, the theme is going to be New Frontiers in Naturopathic Medicine, and we have 7 presenters, and we also, each day, we're going to do something a little bit different, where each presenter will either present on 2 topics or sort of broken up, and at the end, all 4 or 3 or 4 of the presenters will be on a panel, so there can be an interactive discussion about whatever it is that people want to talk about and discuss that. Rebecca will be there, hopefully, to do an update. And one of the reasons this is important is because, just like as with you, people ask you these questions. Sometimes they're questions that probably should be for us. We get questions nonstop about licenses, about why did you do this, and really it's educating them as to who we are, who you are, who she is, who I am, and the fact that, we're actually 2 different bodies and we do different kinds of things. And, so there's ultimate patience, and we just respond to a lot of these questions. But rather than just saying, just call the NMC, about whether or not you can perform this and if it's in scope or not, we try to work together and have as much information as possible on our website. We have an FAQ page, and because it got so, numerous questions about the nurses, about different items that you've discussed today, we kind of compiled a whole list and said, let's see if we can't get answers to all of these things, get them, put them into the FAQ pages if possible, get them onto the NMC page. And so that's what we're trying to do, get clarification on a number of different items. We also have a Facebook doctors group, and doctors can go onto this specific group. Only our member doctors can be on it, and they can ask a question. They're supposed to. And then, if somebody says, well, is it possible for me to do this without MD or DO supervision? I don't have that answer necessarily. And we were lucky that we had Dr. Greer there, who had a lot of those questions and answers available because she's a doctor. So we just, say, look, you can go onto the NMC page, you can go onto our FAQ page, you can go and ask another doctor in the Facebook group, and hopefully you'll get the answer that you need. But always, if it's something that has to do with something legal, we tell them you need to get an opinion, because it's not for us. I'm not putting the organization at risk and creating any liability for any of us, because these are questions in many cases that you really need to have somebody advising you, either an accountant or a lawyer or something like that. So that's just for your own background that we're trying to kind of get clarification. I noticed that we were talking today about formularies and different kinds of pharmaceuticals that might need now new training or whatever. One of the biggest things that the CNDA does is provide continuing education webinars, and like for instance, the conference is going to be, I think, 10.5 continuing education credits. One of the biggest issues that we have is getting enough pharmaceutical credits through the webinars that we offer. And so my feeling is that if we can send out a call for abstracts on specific topics that might be beneficial, it might help us get what they need, what you need. Because, is everybody now, when they have to get these certifications, do they have to go back to a college to get it? Where are they going to get these CEs? And is there a role for us in this to make sure that we get the right kind of education out there?
Sure. So I can answer part of that question. When we were discussing the update on the formulary committee a little while ago, I know Dr. Yoon had mentioned that they may have to take the elective pharmacology portion of the NPLEX. Now, that is just for people that are coming out of school that are taking the NPLEX anyway, so they're taking that pharmacology portion. I know that we're still kind of working on if we're going to grandfather people that have already been under a of a supervisory contract with a physician, whether we're going to just kind of allow them to be grandfathered, or if we're going to make them go back and take that pharmacy. So that's still, I think, we're still working on that. I'm not sure that that was that we were finished yet on that. So we are still going to be talking about that. I know that the NPLEX is also bringing out an IV therapy elective exam as well. So I know that that's going to be there. And these are just things that are being brought kind of to play because of the regulatory problems that some of the different programs are having getting that scope. We've got a lot. I know Virginia right now is trying to get regulated, and so it's one of those things that when the legislators are looking at, okay, is everything in place to make sure that these people are qualified and that they're competent, and this is the reason that we're saying, yeah, you know what, we probably should have that elective course or elective exam. So it's not something that we have made a decision on 100%, but that will be done kind of at that level. However, there is still going to be the need to have that continued education for the CE for for pharmacology. So what we can do is we can reach out to FNMRA, ANP, find out kind of what they're seeing in trends for pharmacy, for NDs, what they're looking at, what they're wanting to get taught, and then we can kind of provide that back to you guys so that you have some of that too.
Because obviously, if we work in cooperation, then that we can.
And just to clarify on that question, we can take any CE event offered to MD, DO, pharmacists, chiropractors, and there are many, many, many providers online, including Hippocrates and Medscape, and there's a bunch of them where you can just go on, you can do up to 16 hours every 2 years, self-study like through the
15.
internet. 15? 16.
15. Self-studies 15.
Yeah, they want the live as much as possible in pharmacy CEs, so at least that's what the request.
Yeah, and I would just think about categories of things most often seen in primary care, like antibiotics and dermatological agents or,
And again, with the
Depression drugs
specialized
and-
injection therapies, with the specialized injection therapies, we can certainly get you information on how CNDA could apply to be one of the providers for that, because clearly we will need, we'd like people to have multiple options for getting those requirements and certifications in place. So we can let you guys know, as you're one of the big CE providers, how you would go through that application process and get approved.
Great. Okay, good, that's good.
and each of those would have pharmacology components.
Yeah, so we'd want to definitely designate with those, how much the pharmacy CE is, how much of it is pharmacy CE in that scenario. And I know that's an issue here in California, but also in other states as well, where that needs to be broken down. And of course, the problem with AMA credits is that they are not broken down in that way, and that can be a significant issue for our licensees.
Aren't we
So-
allowed to self-certify, like estimate the number of hours spent on pharmacology if we take something that's not separated out?
For the majority of the time, you will end up having to self-certify, and only because the only ones that usually do break those down for you are CNDA, because we're that special,
Yeah, and
profession that
AAMP.
has CE for pharmacy, except for the pharmacists. We are the only ones. So we will usually have to break that down, and that's fine, and we're okay
Good
with
idea to get a copy of the syllabus for the class, just so that if you get audited, you can
Right.
show that you really did your pharmacology as part of the training.
That would be the individual doctor.
Right.
Yeah.
correct, exactly.
Right.
And in our certifications, we have that, and it shows.
Yes,
it,
you
so,
do.
yeah.
So we are so grateful for that.
All right, and then one other thing, just to let you know that when I first came on, and I met some of the people through the AANP, the American Association of Naturopathic Physicians, one of the things that we initiated was a relationship between the other states. So the executive directors now meet on a quarterly basis on Zoom or whatever the heck it is that we are, and we kind of talk things through, and we'll email each other and say, hey, I just found this great benefit, or, oh, we've got a problem here, what have you guys done with it? And so it's really nice to have that again, relationship, which is if we can start building those relationships with the nurses, with other organizations, with affiliated medical professionals that might enhance opportunities for NDs or just the way we work, then I think that's something that we will do and
Absolutely.
work in unison.
Yep. Yeah, and I know both the ANP and FNMRA both are extremely great resources. I know FNMRA facilitates other states that are trying to get regulated right now with kind of the states that are already regulated, like Arizona and Washington and Oregon, and try to, provide sample language. So, and I know that, we just sent letters of support for Virginia. So it's one of those things that, we all really try to help one another when it comes to making sure that we are allowing our licensees to practice as they were trained to practice, while keeping consumer protection, at the highest regard. So with that being said, I, again, am on the board of directors for the FNMRA, so if there's ever a need for us to have resources, it's very easy for us to get. So I will definitely gather some information for you guys, as well as the nursing, who has the nurse supervision in other states. So we'll go ahead and get those together.
Great,
think we're
thank you
good.
so much.
Thank you, guys. I
Questions
appreciate
for
it.
Anybody? I didn't ask.
Thank you so much for coming all the way up here.
Thank you.
I appreciate it, because I know you probably didn't feel good either.
Poor
Thanks.
Dr. Cicerone that has the flu. She was supposed to make it here too. But, yeah.
And when we're done with the meeting, we can go through the list of questions that you had, just to make sure you get an answer to as much as possible before you leave, okay?
Thank you.
Yeah.
Thank you.
So I have an addition for the scope modernization, or a question, I guess, more so.
Okay.
Exams. So, being able to read TB exams, school exams, disability forms, things like that.
So that was one of her questions on what you guys are allowed to sign off on. So anything, and it's just dependent on how that form is read. So if it says physician and surgeon, you can't sign it. If it says you're a medical practitioner, you can sign it. And I know that the whole disability form, Department of Motor Vehicles said they had no problem redoing that form, but it's going to cost thousands, and when I mean thousands, like tens of thousands of dollars to recreate that form and get it into their system, just to change and add us on there, because I know that there's chiropractors are on there, and like a chiropractor's on there, but a naturopathic doctor who is also primary care isn't. I just can't wrap my head around that, but I think right now it's just terms of financially, whether we can pay for it or they can pay for it, or who's responsible for paying for that change.
How often do they update?
But I think if this is something that we had ready for the sunset language, we may be able to have them wiggle it in there, and then it would be whoever's responsible for that form to take care of it. Because if the law says they shall, then they shall. So they must. Not may. So I can definitely add that to the asks of sunset language. I mean, never a guarantee, but
Yeah, I think it really gets down to that consumer safety issue. Like, if a person needs a disability form and they have to go to somewhere else to get it, it's really not in their best interest for their health and safety.
especially if that physician that has to sign off on this form has no knowledge of this.
Person's
Parties,
case, right,
case, right.
absolutely.
Absolutely.
Another thing to consider on that subject, different subject, same approach, is, I don't know if we've done this yet today, how I'm so sick of everywhere I look for getting CEs, it says approved in all states except California, approved in all states except California, approved in all states except California.
I can tell you why. Because a lot of states have reciprocity when it comes to their CE. So like a lot of places will say, we'll accept Oregon CE. We don't, because our CE requirements are higher than what theirs is. And unfortunately, ours is in statute, so we're just at a higher regard.
What's the main point of change? Oh, is it the conflict of interest
Is
thing?
the conflict of interest is the major portion of that. That, and because in that text or language, they made some changes of it has to be scientifically proven or peer reviewed. Like, there has to be something that shows that it works. So you can't just go and take some crazy CE that hasn't been proven or hasn't been researched by your peers, and so it's just, they made a big change when they opened us up last year, or the last sunset, so, which is why people don't like to open up their act unless they absolutely have to, because things like that happen. It's
They
not
changed us?
changed us, yeah.
Did we know that?
When we opened up the act, absolutely, it was Dr. Pan's asks, and he was on the assembly committee, so it happened, and that was the way it was written, and.
How did it come through him?
Because he was on the, I'm looking, oh gosh, nobody's in here from legislative. He was on the assembly side, and when it came in front of him, he wanted that stuff that was in, and I think it came from the American Board of Family Physicians or something, like he took it out of somewhere and said, this is what you guys need in there, because he did not want it to not have scientific-based information being.
It's not a big problem.
No, and so, yeah, no, it was, I think it was helpful in making sure that we do have kind of the most up-to-date information that we're providing to CE for everybody. But it's just one of those things that because a lot of other states don't have that, we just can't say, oh, yeah, it was approved by the Oregon board, sure, we'll take it. I actually have to go through each and every one and make sure that that conflict of interest is removed, that it's just, yeah, so it's time consuming, and, yeah, so there's,
Now everyone can go take ACLS for their CE.
yes, they can, yes, they sure can. ACLS. Yeah.
I did the CPR one, and you get, I think you get a half an hour, even though I spent several hours at home and then several hours in the class.
Was
Or
it-
was 1.5 hours, maybe.
Was it the recert or was it the main one? Because the main one,
One.
you should have gotten all your hours for that. If it was a recert, then it's only half.
Might have been
Same
a
as
It might have been a
physicians.
recert.
Okay,
Yeah.
then that's probably why.
Yeah.
Yeah, should have kept that first one. All right.
Do-
So is there anything else? Do we have
want
any
to
more public
talk
comment?
about future meeting dates and locations, or
Oh,
are you going
yeah.
to send out a doodle?
That. Of course we can. Okay,
Well, I mean, we don't have to.
well. So agenda items.
Well, not unless you're going in order.
Future meeting. Okay, I'm going to just say, I'm going to ask for established future meeting dates and locations, but I always end up sending out a doodle because not everybody knows their,
You didn't have to on this one.
Do we know
We did.
generally what month we want it to be in?
I would say at least by April, March, April, May, yeah.
So if it's in April, we're going to have to work around everyone's spring break.
I'll be
Yep.
gone the last part of April, the whole month. If you care.
And the first week of May, I'm unavailable.
So what about earlier, like the 7th
My
of
kids are out
April?
for the first 2 weeks of April. Which doesn't mean I can't come to a meeting, it's just a little more complicated.
So,
So do we want to go, I mean, March seems kind of soon, actually.
it is, and I'm not sure that we're going to have quite enough by, well, I don't know, it just depends on how fast we can kind of get talking with the RN board, and, because we do want to get together soon, because that's coming up quick, and I know it seems like it's still a year away, but in the final part of this year, we're actually ramping up for Sunset already. We're already talking, they've already got some sample language going, so.
Can we do remote, what's that, teleconference
Teleconference?
meeting? Can we, do we have a Southern California location for that? Because that was the problem with last time.
Right. So So, yeah, I have to find a host to have the participants from SoCal go there. But I don't think that'll be a problem as long as we have 90 days of leeway time, because that's how long it takes to get a contract done.
Because it sounds like the majority of what we need to talk about is probably not a full-day meeting anyway, but that we should do it sooner rather than later. So if we could come up with a teleconference meeting date,
about the-
people are going to have a lot more flexibility on that as well.
How about the week of May 11th?
No, that was the problem, is the two members that are in SoCal right now don't have an office that's meets all the requirements for ADA and stuff, so. And of course, we don't want to go into Starbucks, so we were trying to get with one of the libraries down there, but even the libraries are charging now. Like, what?
Does DCA have any LA offices?
So we do.
Field offices.
We had some field offices, so we'll reach out to them. DGS. Where are you guys now? Santa Monica? How close are you guys to Santa Monica?
It's like another country, but we can go there.
See, that's the only thing is.
It's not a
I have to
problem.
remember them traveling too.
No, I'm in LA, but
And so
depending
Shirley.
upon the traffic, it will take just as long for me to get from where I live to Santa Monica as it does for me to come here. But that's okay, I don't mind.
Brianna
Yes.
sent me a list of DGS list of all of the offices
all
down
good.
there. So it's fine. We
I could
have
go to Santa Monica.
some
How about you,
resources. Oh, Shirley's out. So yeah, no, we have a list that Brianna, who was in here a little while ago, sent to us with, DGS sent out a list of all of the state agencies that are down there that have some meeting space that we can use. So I will make some contacts, see if we can find something close to you and Shirley, because I think you guys are both Los Angeles area, right? Metro area, okay. So yeah, I'll find something in the Los Angeles area so that you guys can just Uber there and back, and
Is it a problem if we, to do it at the association office?
it is not a problem. However, if it takes as much time for them to get over there, they might as well just come to Sacramento.
Right, it will be cheaper to go to Santa Monica.
Hmm?
You don't have to buy an airplane ticket.
She's a block from the metro, so you could take it from an outlying
Oh,
area
that's
and
good.
park your car.
Yeah, pay mileage. Yeah, we could do that. We could do that.
And is it ADA
So-
compliant, your office?
Now, where is it located? It's in Santa Monica on Broadway and 17th.
Is it ADA compliant?
There's 3 steps that you
Is there a ramp?
Oh, yeah, you probably can't have it there then.
Unless you
They're
build
really
one.
big on making sure that it's accessible to everybody, so, and usually as long as somebody could come out and help, but with steps, if somebody was in a wheelchair, they couldn't. So it's fine. We have a list. We will find a space. We probably could do the next meeting as a teleconference meeting. I'll find a space for SoCal people.
And do we want to do that in late March so that we can talk about the RNs?
Yeah, let's do that.
Let's try for that then.
Okay.
Cool.
So March.
Late March won't give us 90 days, though. Do we need 90 days?
With other state agencies, normally I won't have to do a contract because most of the offices are free.
Okay.
I don't think anybody charges.
So any agenda items for future meetings that we need to talk about, or can we?
So do you want
adjourn?
to go for like March 24th or 31st?
It can't be the 31st. I have another meeting with FMNRA. So I could either do the week of the 16th or the week of the 23rd is totally open for us.
I'm sorry, I would like to respectfully request not to do it on a Tuesday. I'm taking a class now, which is on Tuesdays at noon.
Okay.
So
Well, like I
maybe-
said, with a teleconference, I
How
think we
would-
all have a lot more flexibility.
How would Monday, the 23rd be? I believe spring break is for a lot of kids short after that, if that matters to anybody, but
My kids are okay to be at home by themselves
Yeah.
now. They're old enough.
23rd of March? Good for
23rd
everybody?
is fine with me.
And do you want to do one backup date just in case? What about Thursday, the 26th? As a backup.
That's fine.
So 23rd's first choice.
Right.
And
Okay.
is this going to be like 10 to 3 on the phone kind of a thing?
No, we won't have, I think we're only going to have a couple of, it's just
Okay.
kind of bringing the RN stuff back and whatever I find out. So,
Maybe
yeah,
like
it'll be
10 to
quick.
11 or something.
Yeah, generally,
Whatever else we
Yeah.
can put.
teleconference meetings are about 2 hours.
So you guys want to do it around 11-ish, 10-ish,
10 is good.
10? Okay. So maybe we'll do 10 to 12, and I think we could fit everything in there, maybe less, so, okay. All right. Did you want to be ambitious and try for one more date for the next meeting after that, or do you want to wait and see what we kind of have at the end of that meeting?
If you think you have a good idea of when we will need to have another meeting, it doesn't hurt to put it on a calendar. We can always move it.
Do we, we'll probably want to meet in the summer.
Uh-huh, probably around June. Because we're going to be starting to have talks with our Sunset Committee around that time. We're going to be talking with DCA, and they usually start it about 6 months prior to the year.
We probably want to do earlier June so that we don't hit people's summer vacations.
Okay. So June 8th, maybe? Sorry. So Monday, that's the second week. It's a Monday.
Monday, June 8th?
Mm-hmm.
Okay.
This is a
We'll
teleconference again?
tentatively put it on here. I don't know whether it's going to be able to be a teleconference right now or if it's going to be a full meeting, but
Do you want to do maybe Thursday, the 11th instead? Thursday, the 11th?
Thursday, 11th instead?
Okay.
Okay, so I'm going to go ahead and tentatively put June 11th down, and we'll figure out later location-wise or if it's going to be teleconference.
So it was the June the 8th and June the 11th and March the 23rd and March the 26th?
I think we took the 8th off, so it's just June 11th, correct? Yeah, okay.
Oh,
That is my
So
wife's
just one-
birthday, but
one
I'm
day.
just okay.
23rd and June 11th.
Yeah,
Okay. Oh, but you were also talking about
It's just as a backup
March the
if something
26th.
happens.
Yeah.
But 23rd is what we're going for.
yeah, 23rd is what we're going for, in case for some reason we don't have quorum, because right now, if we lost one more person, 1, 2, 3, 4, 5, a quorum is 5, so I think we're okay, because I'm hoping that 3 people are never absent on the same meeting. And hopefully by then, we'll have some appointments made. But right now, that's just, I want you guys to be aware that we've got 2 vacancies. Okay, so let's go ahead and go to tab 12, agenda items. So I'll put the RN oversight.
And maybe report if it hasn't been done already on all the stuff that you were going to do, like the workers, independent contractor question.
Okay,
What else is on your
Subcommittee
to-do
updates.
list?
I'm sorry,
Subcommittee updates.
subcommittee updates.
What else is on your to-do list?
Let's see. I think that's about it. And of course, we'll do the update on scope modernization.
We'll probably have minutes from this meeting,
Mhm.
reg update, but,
Reg update, yeah.
date too for the formulary subcommittee.
Sorry?
We need a date for the next subcommittee.
Yes, I'm going to send you guys out a, okay. All right, and then if there's anything somebody thinks about and we're already gone, just shoot me an email and I'll place it on the list too. So, all right.
All right, so at this point, I would like to adjourn this meeting of the Naturopathic Medical Committee. It is Tuesday, January 28th, 2020 at 3:10 PM.
Perfect. Thank you.